Former Prime Minister, Mr. Odinga, Raila Odinga, has been in India for the last few days in connection with the treatment, the eye treatment of his daughter at an Ayurvedic hospital, Ayurvedic eye hospital in the state of Kerala. And it's his private visit since Prime Minister Modi and Mr. Raila have been friends for a long time. They have known each other for many years. The Prime Minister's tweet after the meeting, and also the interview that Mr. Raila Odinga gave to an Indian news agency, what we know that they did express their commitment to further improvement of the relations between the two countries. And also Mr. Odinga did mention about the substantial improvement in the eye condition of his daughter thanks to the Ayurvedic treatment in India. And in his interview to ANI, he also mentioned that he discussed with the Prime Minister of India about bringing that kind of treatment, Ayurvedic treatment, to Kenya, and also that there should be greater use of the indigenous, locally available plants here in Kenya in the healthcare system here. The collaboration in healthcare sector between India and Kenya has been strong already, and there are initiatives underway to strengthen it even further. What came about today at the meeting was a discussion focusing on the use of Ayurveda in Kenya, because as Mr. Odinga did mention that he was very pleasantly surprised at the substantial improvement in the vision of his daughter thanks to that treatment, and to have more cooperation in the healthcare sector using the Indian traditional systems here. I think it's something which has a promising future, and in our format of cooperation, on a mutually agreed basis, on mutually agreed terms and conditions, I think we can add these traditional systems of medicine, cooperation in this sector, in our larger healthcare cooperation. I think it's a win-win situation, and this system of medicine also is a low-cost solution. Low-cost solution using locally available resources. And if such a system which has proven evidence-based efficacy in India and Ayurveda being practiced elsewhere in the world, I think this can be integrated into the healthcare system in Kenya as well. In the healthcare sector, as you know, cooperation between India and Kenya have traditionally been very strong. It has been a long-standing cooperation, one of the pillars of cooperation between our two countries, and including during the difficult COVID times. As you are aware, India was perhaps the first country to supply COVID vaccines to Kenya, and we are very satisfied that India played a role in initiating the vaccination drive, COVID vaccination drive in Kenya. We have also participated in training of Kenyan specialists in COVID-19, and also we have shared details of a digital platform developed in India. It's called CoWIN, for management of large-scale COVID vaccination campaigns, and we hope that the tradition of close healthcare cooperation will go strength to strength in the coming times.